Hello, this is Stephen Thomas, nephrology nurse practitioner, owner of Kidney Connect. This is Module 2, Chronic Kidney Disease. Objectives. We'll be able to understand the general concepts of chronic kidney disease, be able to list the stages in correlation to when clinical manifestations occur, know the most common diseases that progress in the staging of chronic kidney disease, list the common symptoms of CKD and when they present, know what races, ethnicities that are affected the most with chronic kidney disease, and understanding the importance of patient education in the CKD population. Some of the content we'll be going over today will be definitions, introduction and general concepts, incidence and prevalence, demographics of CKD, clinical manifestations, staging and risk factors, diseases of the kidney, diabetic nephropathy, hypertensive nephropathy, morbidity and mortality, slowing the progression, and patient education. Definition. CKD is defined as abnormalities of the kidney structure or function present for greater than 3 months. The 3-month time period is an important window to distinguish chronic from acute. Kidney disease has been classified in 5 stages that are based off the level of the kidney function, progressing from stage 1 to 5 according to the Kidney Disease Outcomes Quality Initiative. International guidelines define CKD as decreased kidney function shown by glomerular filtration rate of less than 60 mLs a minute and/or marker of kidney damage for at least 3-month duration. Introduction and general concepts. Chronic kidney disease is a common condition characterized by evidence of kidney damage or dysfunction, as well as cardiovascular disease. Kidney disease impacts millions of people around the globe. 30 million people, or 15% of the US adult population, are estimated to have chronic kidney disease. 48 of those with severely reduced kidney function, but not on dialysis, are not aware of having chronic kidney disease. This is going to be a common theme that we'll be seeing throughout the presentation. CKD is estimated to be more common in women than in men, 16% versus 13%. 1 in 3 Americans are at risk for developing kidney disease, and the risk increases with age. It is estimated that 1 in 10 people in the United States have CKD but do not know about it. Each year, kidney disease kills more people than breast or prostate cancer. In 2013, more than 40,000 Americans died from kidney disease. CKD develops slowly with very few symptoms, often not diagnosed until the progression is advanced. CKD is a worldwide public health problem. It is present in many countries. Over $1 trillion is globally spent on kidney failure care. In the United States, adults ages 18 and older, CKD is associated with medical diseases such as diabetes, hypertension, and cardiac disease. Incidence and prevalence. Incidence refers to the occurrence of detection of new health-related events in a particular population at risk during a given period. It can be expressed as a count, the number of people diagnosed with chronic kidney disease, a risk, the probability of people being diagnosed with kidney disease, and the rate, which is the number of people diagnosed with kidney disease per person to the time at risk for it. Prevalence refers to the presence of a health-related condition in a particular population at a specific point in time, or less frequently during a specific period. During 4 periods of 1999 to 2014, stage 3 CKD rose from 5.4% to 6.6%, with higher rates attributing to the aging baby boomer population. While CKD is highly prevalent, most people are unaware that they have it. As a consequence, CKD has been labeled the silent epidemic. 9 out of 10 people who have CKD3 do not know they have it, and we'll get into why in a little bit here. CKD continues to be the major cause of hospitalizations, physician visits, and lost productivity. It is currently the 8th leading cause of death. We're going to go over some demographics here. So the incidence of CKD is higher in those 70 years and older. Geographic locations seem to matter in determining the prevalence of CKD. For instance, the South has more adults with CKD. A majority of the adults with CKD are married with an annual income of $35,000 a year. Many of these patients are uninsured, and Medicare end-stage renal disease programs only cover people whose CKD is already advanced to the point to where they need renal replacement therapy. The main point in this whole in the demographic slide is that if you have poor access to quality food and poor access to care, and you have CKD, the likelihood and the prognosis of you developing end-stage renal disease and being on dialysis is very high. The burden of chronic kidney disease falls particularly on racial and ethnic minorities. These individuals are less likely than Caucasians to achieve control of these diseases due to access and quality healthcare. Mexican Americans are 1.5 times more likely to develop chronic kidney disease. African Americans are 4 times more likely than Caucasians to develop chronic kidney disease. And those who have hypertension may have a generic variant that increases their likelihood for developing CKD. Clinical manifestations. CKD is largely asymptomatic until the later stages 4 or 5. If you remember in the previous slide or previous slides, we saw that most people are unaware that they have chronic kidney disease. This is the main reason why we do not see symptoms until the later stages of stage 4 or 5. And in my practice, when they are at the late stages of 4 or 5 is when we're talking about dialysis. Beforehand, or like in the early stages of 4, maybe late stages of 3, we'll be more focused on what the kidneys are all about, what they do, how the filters of our body, and go about the dietary components to delay the progression of chronic kidney disease. Unfortunately, we start talking about dialysis right from the get-go because it is something that they need to have a backup plan before life starts to change for them. It's currently or commonly detected with routine blood work. And so when we're looking at the baby boomer population growing in the percentage of developing chronic kidney disease, most of the stories that we often hear are, I don't go to the doctor unless I'm sick. Well, when you have chronic kidney disease, which is labeled as a silent epidemic, you're not going to know you're going to have symptoms until the late stages of it, which in most cases is almost too late. Some etiologies of CKD progress more quickly, thus resulting in kidney failure occurring within months. Most patients that are diagnosed with CKD progress slowly over time. Unfortunately, most will die prior to reaching stage 5 chronic kidney disease. And we'll get into more of that when we talk about the disease processes that are correlated and related that can progress into the chronic kidney disease. Symptomology can be attributed to complications of reduced kidney function. When severe and is no longer managed medically, must be treated with renal replacement therapy or transplantation. Complications of the disease become apparent and more readily identified in the later stages of CKD. When GFR is decreased, less than 30 millimoles a minute, which is considered stage 3B or early stage 4. Here are some of the clinical manifestations that don't occur until the later stages of chronic kidney disease, stage 4 and 5. Fatigue, ammonia-smelling breath, loss of appetite, foamy urine, which can be attributed to diabetic nephropathy, difficulty urination or frequent urination, and some people often experience kidney pain, although they are few and far between. Some other symptoms that they experience that aren't listed on the picture here are pruritus, which is like itchiness of skin, confusion, edema of the extremities, and difficulty breathing. And most of the time when people are experiencing these symptoms is because of the buildup of what we call uremia, the buildup of toxins. When your kidneys aren't working properly and when they aren't filtering out properly, the electrolytes, the toxins, the additional water, especially during the late stages of CKD, is when we'll begin to see this.